Hi, this video is the hair transplant on a black African woman who actually flew in from the Virgin Island, and thanks for allowing me to show the video, at least on the eyebrows and up. And so she has a pretty advanced hair loss pattern. Is coming back all the way here, although she has some baby hair here, but it's thinning out. So we'll be attempting to do at least 3,500 grafts today, and trying to fill in from all the way toward from the right side, all the way toward the top, and all the way toward the left hand side. And again, so all these baby hair will be shaved, not the whole head, just the baby hair here where I'm putting the hair in. As you know, I'm one of the very few hair transplant surgeons who specialize in the art of restoring black curly hair, whether for women or for men. Now, the transplanted hair tend to be permanent, but the existing hair, the hair that is existing on right now, it will continue to thin out. So as you lose further hair in the future, you probably need another procedure. Or sometimes when we transplant on women, more often than not, you might need more than one surgery to have a perfect density. But the more you put in, the less chance you have to repeat it. And sometimes it depends on how perfectionist you are too as well. The more perfectionist you are, the more likely you're going to do another one. But otherwise, majority of the time, if you do the number that I recommend, they tend to be pretty good. And again, it just depends on how advanced your hair loss pattern is. And so hair transplant is not just the surgical skill of the surgeon. It requires a lot of the artistic and aesthetic detail to ensure a very natural result. And the most important factor is to creating a natural hairline, a feminine hairline that is unique for each individual, and we build it around the facial structure of an individual. So it's a custom hairline pretty much, and so we tend to follow the nice zigzag where the residual hair and the eyebrows. So where the temple is, as you see, it pointed toward the middle. For men, Caucasian men, it pointed backward, most acute, Asian men less, and black men is perpendicular. But for women, it tends to point it toward the middle. Where the eyebrows end, the temple should begin there for women, but for men, it tends to be a finger breadth behind it, and then that's where it is. So the temple got to start in and point toward. And the zigzag is wider amount and higher in amplitude for women compared to men. And then once we have the shape down, we will transplant at a very precise angle. For men, it's 0.3545 in the front for Caucasian and Asian. But for black men, actually, it's more flat against the skin. It's around 15 degrees. But for black women, sometimes the angle is not forward, but actually flat against the skin and backward. So we tend to follow the natural angle of the hair that an individual has. So if a lot of her baby hair pointed backward, we tend to follow that. Because we try not to change who she is. And then now the precise angle is important. The selection hair graft is important. We transplant rows and rows of single hair graft in the front, followed by root 2 hair, 3 hair, and 4 hair in the back for bulk and volume. So this is the art of hair transplant restoration surgery on a client with advanced hair loss, class black African American woman, and we'll be attempting at least 3,500 grafts, and on the other side is very advanced as well. Thank you.